Tri-Cities. It's Thursday at 9 o'clock and it's time for Coffee with Karl. We're a day early this week because today we have our guest panelist from Benton-Franklin Health District, and we're going to talk about, it has been approximately 1 year since we headed into this pandemic. And I looked it up because the governor's order is actually on March 23rd. So we're a little bit early, but I think the school districts locally shut down on the 17th. So we're kind of right in the zone. And so today we're going to have a look back on where we've been and where we're going as it applies to the COVID pandemic. So some great guests that have been great partners to us on Coffee with Karl in the past. I'd like to introduce Dr. Amy Person. She is the health officer for Benton-Franklin Health District. Good morning, Dr. Person.
Good morning.
It's good to see you again. Thanks for joining us.
Sure. Happy to be back. Am I doing my coffee cup now, or see? It's been a little while.
I'll just introduce you and Jason, and then we'll do that. But
I've already forgotten. See?
That's okay. That's all right. I think you're probably in 100 Zoom meetings a week, so no worries. We also have Jason Zaccaria. Jason is the district administrator for the health district. Good morning, Jason.
Good morning.
Now we're going to talk about coffee mugs. And that was a great intro, Dr. Person. We've been pretty open on Coffee with Karl that anybody wants to give us a mug, we're happy to talk about their business or their organization. So last week I got a phone call from Mick at Minuteman Press. They're in historic downtown Kennewick on Cascade Avenue. They do great work for printing. We use them for our stuff. Their business has been affected because they do a lot of printing for big events and things like that. So Mick called up, he made us a mug special for Coffee with Karl. So we're excited to talk about Minuteman Press this morning and definitely promote their business. So that's my mug. It's kind of cool. I got a new mug. It's a really nice one, really cool graphics. So Dr. Person, do you want to go next?
Sure, that's great. And it's great that your mug's out there supporting local businesses, because I think that, that's important for all of us to remember. So let me see if I can get mine, be in the right place. So yeah, Nikki, one of our staff, gave this to me. It says, be good, do good. And for me, it's a great reminder that it's not enough just to do no harm. We really, want everybody to come out of this at some point better off than they were before. We're not there yet, but hopefully we'll get there.
That's a great reminder. Thank you. And a great mug too. Jason, what do you got for a mug or a coffee story for us this morning?
Well, Karl, I have this morning, and I'll try and put this up into the monitor so that folks can hopefully see it. It says, if you can see this, you're standing too close. And this from an esteemed colleague within the organization. And you might guess who that is. And it seemed very appropriate that, if you can read this, you're standing too close. It's very appropriate for our current situation.
That is very appropriate. And I broke my first law of Zoom, like not to try to go to the bifocals, but I had to read the mug. So I guess it's okay over Zoom to be that close to read it, but that's a good rule of thumb. For those of us joining us on Zoom, we'll use the question and answer feature at the bottom. If you have a question as we go through our discussion today, feel free to put it up there. And if you're on social media, you can always ask your questions in the comment box, and we'll do our best to get to all the questions that we have come in this morning. But, looking back on 1 year, and obviously we talked about it before we came on, but, you guys haven't really had a break. And so it's probably hard to kind of push back and have some perspective. But Dr. Person, do you want to kick us off and just give us a recap maybe of, I don't want to say what we've been through, we'll get into that a little bit deeper, but how are we doing? Like, what's the outlook right now as far as, case rate, hospitalizations, and maybe vaccines, just an overview if you want to kick us off on that.
Sure. Right now, I think we're really in a place that we can be, I'll say, cautiously optimistic. We are coming down from our third wave, and in Benton County particularly, we're seeing numbers drop back down to what we saw in September, which is great. Franklin County is struggling a little bit more. Their rates are dropping, but not quite as fast. I think this parallels as well what we are seeing with vaccinations. In Benton County, we have almost 50% more people who've been vaccinated than who've been infected over the course of this pandemic. So we really see where we're moving to a place of having people who are safely protected. Franklin County, not there yet. They're in fact about the opposite, that still about 50% more people have been infected than have been vaccinated. That comes from a couple reasons. Some of it's demographics, some of it's some of the access issues we've been challenged with. So hospitalizations dropping very nicely. We're still seeing deaths due to COVID, not as many, but we passed kind of a sobering benchmark, which is that 1 in 1,000 community members in Benton and Franklin counties has died from COVID. And what really stands out to me about that is that 1 in 1,000 people in our community has died from an infectious disease. I actually had to go back looking through death statistics. I had to go back to the 1950s to actually find a point in our area when an infection was that significant, and it was tuberculosis. So, again, in modern America, 21st century America, we don't expect to see that. And so that's what drives me, every day to think about what can we keep doing to change things.
Yeah, that's a an interesting way to put it. And you would assume that in the 1950s, if we had a local tuberculosis outbreak, it might relate to some housing things or something, right? Like, I think that maybe people were living together in some way and that kind of led to an outbreak or something like that. And again, 1950s is a long ways from 2021 where we live today. But here we are still dealing with a pandemic. I think that's good perspective to bring to it. And of course, 100 years ago was really the last global pandemic that we had with the flu that we went through at that time. And I think that, I think that's something that we always have to remember, because a lot of people ask, like, well, do you know somebody that's died from COVID? And I just had a good friend from college. Her dad died back in Idaho last week. And so that was probably the first person that I've known that's died. And he was in a long-term facility and stuff. And so I think when we have those connections, it really reminds us, to stay diligent, that we're not out of the woods yet. The numbers are getting better, but we still need to follow Jason's mug and follow the everything that we've been talking about for a year now, for sure. Jason, from the overall health district point of view, you want to add anything to what Dr. Person said about how are we doing, and even, just kind of that general outlook?
Yeah, sure, Carl. I think, if we look back roughly a year ago, I think we can all remember the days of the initial shortage of personal protective equipment and even toilet paper. I think really for public health, back in January of 2020, I think we need to recall that we had our first positive individual with COVID in Snohomish County. That was kind of a real wake-up call for us back in the day. Looking a little bit further forward into February, we at the health district here locally activated our emergency operations center. And then March of 2020 was really quite a busy year for us. We had our first positive case confirmed in Franklin County. The pandemic was officially declared a pandemic. That was the time that the governor ordered all schools closed, and our health district requested an incident management team to help with the response. And of course, the cities and counties declared emergencies too. Also during March, the governor ordered a stay home, stay healthy order, and a bit later then came the face covering orders and again, the startup of our testing site. So there was a great deal of really fantastic work that was initially accomplished by many teams out in our community. I think COVID was kind of recognized as a novel virus, and to scientists and public health and epidemiologists, That didn't really shatter people very much, but to the public, what came was a fear of the unknown. Like Doctor said, there has not been substantial loss in our community. And like you said, Karl, it was many, many decades ago where we had a real pandemic. Having said that, during this early period of time during the pandemic, the district really strengthened our partnerships with our municipalities, our cities, our hospitals, our elected officials. That's the point in time that we started what we call our local decision maker briefings, which has not only the health district, but the hospitals, the schools, the elected officials from the counties and the cities. And also shortly thereafter, we started what we call our municipal advisory committee, which is kind of a think tank for how to keep us moving forward safely. There was strong compliance also during this time by the majority of the people. And we need to, I think, recognize lastly, Karl, our small business owners and the folks out there in the community who sacrificed so greatly during that time to help save lives. So that's kind of where we've been, in the past year, from our perspective, at least getting started.
That was really well said, Jason. Thank you. I appreciate the recognition of the small business owners. So many have had to close down and have just been affected, and really, being a small business owner, there's a lot of unknowns, but in the pandemic year, trying to stay compliant and trying to stay safe and then serving their customers has been a real challenge. But, I think very generally, everybody's come together, and we've talked about it before, but I think that's the great thing about our community is we have a long track record of coming together to overcome things that have happened in the past. And so I think the pandemic has been a good example of that for sure. Dr. Person, I was going to ask you, when we first started into this, I remember listening to the governor, and we even had on a disease, I don't think he was an epidemiologist, but like a data scientist from an institute in Seattle, and I should have my notes here where I can remember his name. But back then we talked about the R0, which I think was a factor of, if one person's sick, how many other people in the community will they be infecting? And I don't hear it as much anymore, and I haven't seen it, but do you have a sense of that, or is that something that we still track? It seems like that was a good, early on, like that was a good indicator. If we're above one person infecting one other person, that's bad. And then if we're below one, that was kind of a general guideline. But is that something that's still used in the data that you guys are tracking?
Yes, we are still using that. Department of Health has taken over the disease modeling reports that the Institute IDM was doing previously. And Eastern Washington, we're at a point now where we are more consistently seeing that are not just below 1, which is good. That's where we want it in terms of not seeing sustained transmission or sustained spread of the infection. We'd really like it to be not just below 1, but further down, 0.7, 0.6, to really be at a place where we're confident that it won't sort of rear its ugly head again. The challenge we're having now is with the introduction of the variants, which we're seeing more and more of. That's the wild card, right? Because we're not sure how that will entirely play out. Other countries where variants have arisen, they've become the primary COVID-19 cause, but we're also at a time now where we're getting more and more people vaccinated. And in the other countries where the variant started, that was prior to when vaccines were widely available. So, we've got things pushing and things pulling, and so trying to interpret where that is. But again, that's why we're cautiously optimistic. We are seeing that R0 staying more consistently below 1. So that's a good, hopeful sign.
That is a good, hopeful sign. I think I'm sure maybe about 20 years ago, I read a book about the 1918 flu, and I learned a lot from that. And I'm by no means a scientist, but I think the interesting thing about the 1918 flu, and I think that obviously helped maybe create or shape public health in the United States. And then a lot of the work that's been done, is kind of based off of that. But the challenge that they faced back then was how fast the virus mutated. And because it was, I think, generally more virulent, and we didn't have science to the level that we do today, that how it mutated and changed became a real issue. And obviously they weren't creating a vaccine in a year. I don't think the flu vaccine started till decades after the flu epidemic. But I think that mutation is what people don't understand. I mean, there's a lot of things that are hard to understand about a pandemic, but as it changes, that's what you want to try to control. And I think some of the numbers that you gave are really good, that, if we get to that point where we have, significant population vaccinated versus getting infected or have been infected, then those two numbers are big ones to track. And Dr. Person, can you go into a little bit more detail on that? Like what, we hear people talk about the herd immunity. And is there a statistical number that you guys track that is a percentage that's vaccinated or has been sick that you try to get to sort of, start to push all the numbers down significantly and maybe see an even faster drop off?
That, this is another area that we're continuing to learn because this is a pandemic. We're very good at predicting what level of immunity we need for our diseases that we control through vaccination. So we know measles, you typically need to have, that number has to be in the high 90s. So, 95, 97% of people have to be immune or vaccinated to prevent spread, which is why we're starting to see measles, or we've seen measles outbreaks in the past. Mm-hmm. Other things like diphtheria, that number can be 80%. So our challenge is that we originally assumed with COVID-19 that we would need to see levels of 90% in order to achieve this kind of herd or community immunity. But that number has dropped over time, and it's because we're having to play in that we have people that are getting partial immunity or temporary immunity from being infected. So now people have used the number about 70% people vaccinated or immune to reach that point. Again, that may change. Sure. Over time. And we do see some countries that have reached that point. Israel has about 70% of their country has been vaccinated, and they've seen significant drop in transmission because of that. I will say the challenge we'll face with this has been the challenge we've faced not just with COVID, but with many things public health has dealt with in the past, is that the 70% isn't going to be equal across all of our residents, all the members of our community. Sure. We're going to see that some areas, particularly people that are well educated, very mobile, access to technology, access to lots of things, are likely we're going to get to getting them vaccinated very quickly. And then the populations that have been hardest hit by COVID, unfortunately, are the ones that we struggle the most with in terms of ensuring that they're going to be able to get vaccinated. And that's been the driving force behind the prioritization of vaccines, that I know, sometimes people are asked, why some groups versus other groups. And a lot of it is really around trying to ensure that the people that have traditionally been left behind, by society, by public health, by a lot of other things, that we're not continuing to do that. Because if nothing else, that's what COVID taught us, is that when we forgot about those populations. I mean, in Central Washington, if we think about our ag workers and our food processing plants, that's what drove so many of the outbreaks and so much of the rapid spread of infection in the summer. So yeah, we are all paying the price for not always being mindful of everyone around us.
That's a great point. I think, you know, even in some of the recovery legislation that's coming out and some of the funding, I think that there's a real effort, not just in what you're describing in the qualifications to get the vaccine now, but then on, you know, some social determinants, you know, trying to make sure that the folks that were left behind, that there's some extra effort made to make sure we connect with them, and that they're, you know, that every effort's made to try to bring them up to a standard as far as, you know, access to some of these things that are really aimed at recovery, and that's a good, I think, a great way to put it. And again, I think, I guess looking back over the year, and we've talked about it before, that our society that's alive today has never been through a pandemic, and so I think there were, you know, and we've all encountered a lot of things that there was just an assumption generally made with, you know, different variations amongst different groups in the community that, you know, well, why don't we know these answers? And when you go into something that you haven't done before, no one's going to have the answers. You guys are literally the experts, and you are our local health district, and you know, do all these, all of your efforts are really aimed at keeping people healthy, but we haven't ever been through a pandemic, and this is a novel coronavirus. As Jason said, it was something new. And so I think that's always good to remind all of us, is that we don't always have the answers, and that we are always going to have to pull together and come together to try to overcome this. And I think, again, that's what I think our community's done a really good job at, but we have to be kind of reminded of that. And Jason, I was going to talk a little bit about maybe, you know, the health district, and you talked before about, you know, there wasn't a big understanding of who the health district is, what do you do, what's your role in the community, but all of a sudden, you know, collectively your whole group was sort of thrust into the spotlight locally about, okay, what do we do now? And I think you gave some good examples of bringing electeds together and decision makers and stuff. But what do you see, you know, in the future for health districts? You know, do you see some needed changes maybe at the state level for legislation or funding or anything like that? Do you guys have any, you know, have you collected like lessons learned, and where do we need to go from here?
Yeah, that's a great question, Carl. Kind of multifaceted. I'll try and answer it in that way as well. I think, you know, one of the things that was kind of frustrating for public health across the state is that, like you said, we've never actually, us being alive now, have never been through the pandemic before. And one might think that we would do much better than we did back in the early 1900s with advancing science, better understanding of public health practices, and so forth. And I think what we've sort of found is that it's not the science, it's not necessarily that component, it's more of the infrastructure and our ability to move quickly as these goalposts kind of change over time. And that's indeed exactly what we somewhat experienced working with our State Department of Health. You know, they have many epidemiologists, and they're fully staffed for the most part in terms of trying to help us get through this pandemic. I think, you know, one of the things that has made us so good early on in this process is the amazing team of professionals that we have, not only in public health, but in our healthcare sector, in our essential workforce. And I think that's going to be something that we really are going to be looking towards in the future is what can we do, what lessons have we learned, and what can we do to affect change in a positive direction such that we can move much faster than we did the last time. And we try and keep politics out of it. But as you mentioned, Carl, there is some legislation at the state level that could affect public health, and likely will in the future years. If it doesn't get through this legislative session, it will the next for sure after that in some form. I think what we're going to see is hopefully more money being put from our legislators into public health. I think that's a clear lesson learned, particularly those who are not necessarily an immediate part of public health or the healthcare system. But the legislators are going to hopefully see that and hopefully will act on that. I think we will see more regionalized structures with better infrastructure to bring resources to bear. So as those goalposts change over time, we can anchor and adjust quickly. And I think that's going to be one of the key pieces of legislation that we'll be going through here. Again, if not this legislative session, the next. So the public health will evolve for sure.
Do you see, as we are working our way out of COVID, I guess is maybe a way to describe it. Do you see like maybe additional positions that you guys have added during the pandemic that maybe you'd keep like a higher staffing level to do certain functions within the health district? I mean, is that, I don't want to get too detailed, but just, wondering, because before, and we've talked about it before, and a long time ago back in Idaho as a county commissioner for a couple of years. So I learned about the health district. I was on a local health district board because, the health district is where you went to get your perk test if you wanted to put in a septic tank, right? And I think that's a lot of what people knew about the health district. Or if there was like you said, a measles or some type of infectious disease outbreak, then you'd hear a press release or something. But, obviously that awareness has gone way up, and your functions obviously have changed during a pandemic. But do you see any, maybe change in like a greater public role or community role coming out of this, or that you guys think would be a good idea, the kind of lessons learned again?
Well, one of the things I think we've clearly learned is that strengthening our partnerships with our community partners and our elected officials has been extremely beneficial. And working with schools, all of the key decision makers across our bi-county region has been strengthened immensely. And I'll consider that a win, one of the wins that we've got from COVID. There's absolutely nothing wrong with that, and it can only get better. And then I think with, hopefully, to answer your question, to get more funding in the door, and as part of our lesson learned across the state, just one of many, I think hopefully will come the filling of some key positions. Once we finally get through the end of this, I know public health, as well as the legislature and others, will be doing hot washes to figure out, okay, we made it out through the end of this, sort of like Shawshank Redemption, and okay, so what are we going to do to make things better? Okay, we're going to put some more money into the public health system and the healthcare system. We're going to recognize the benefits from strong community partners and the relationships that have been built there. We're going to continue to be out in front of the public to do as the best we can in terms of communication. Sort of goes back to a little bit of what Doctor was saying in terms of transparency. That's one of the things that the health district holds high. We hold no secrets. We put things out there for the public. That is our charge. That is part of our mission. And it's not just here locally, but it's across the state and across the nation.
Yeah, that's a good point. I think just thinking of that, and you talked about the interaction between and the partnerships that have really developed over COVID, I think very positively. But I think coming into this, a lot of people didn't realize, even amongst different governing bodies, that kind of the way that public health is funded in Washington is connected to counties and county funding and state funding and stuff like that. So it would be, and you guys don't have to comment, it's just my comment, thinking it might be interesting. There might be some groups in the state that feel like there's a different range of folks that are on the board, for instance, in a local health district that, maybe involves cities or something like that. And you guys don't have to answer that. It's just a comment I'm making that, again, it's one of the things that we didn't know going into it. And not that there's anything wrong with the way it's structured, but maybe to create a governing board, or maybe even a funding body that's more inclusive, that has a wider range of government agencies or public agencies. I mean, just, might be something that we see come out of it potentially, and going that way. Let's see, Dr. Person, you talked before about the kind of the infection rate of, what you see in more of the traditional diseases that the health district would deal with, like measles or diphtheria or something like that. Is the difference in maybe that infection rate that you described versus COVID or some of the variants that we're seeing now, is that each disease is transmitted differently to a certain degree? Is that kind of the basis for why you see the difference?
Yes, that's part of it. It's how diseases are transmitted. Again, is it through food? Is it through breathing in viral particles? But ultimately, the issue with SARS-CoV-2, the virus that causes COVID, is that as a novel virus, everyone starting out was at risk. And that's not something we are used to. Even if we have measles outbreaks, we aren't looking at everybody being at risk. So that's been our challenge with a novel respiratory virus. I mean, if we look back to the last novel virus that sort of had worldwide impact, it would be Ebola, but that wasn't spread by respiratory. So again, a different kind of risk, and this is something we will have to get more and more used to. We are going to see these things occurring more and more often, and that's because our health isn't just impacted by the healthcare system, but people always scoff when we talk about things like climate change and how that impacts health. But the reason we see mosquito-borne viral illnesses occurring further and further north is because of overall temperature change. The reason we see more things like COVID-19 or the original SARS or MERS is that as we have closer and closer interactions between our animal world and our people world, we're going to see viruses able to mutate differently and to be able to jump species and to kind of get under our human immunology, antibody defense system. So this is, part of what we have to recognize is that we're tied to a lot of things outside of what we see in front of us every day, and thinking about how we can integrate that into the work we're doing. And again, not have people go, why should we care about climate change? Why should we, be spending money in public health to address those kind of issues? And so that's on us too, to figure out how we can be able to communicate that better to people. That again, what affects neighborhoods, outside of your zip code, or what happens halfway across the world, that's going to have an impact on you.
That's a good point. And I think that's a great reflection, I think, because maybe it has a connection into, some of the challenges that everybody's seen in I guess, believing different things, be it vaccines or the disease, and it's, how deadly it is and all those things, but they're kind of related into almost like a belief system that folks have. I just read a article, certain things on the New York Times I can get for free. I'm not a subscriber. I don't want to put that out there, but I read an article this morning that was actually a nationwide study that was done, a survey, and it kind of talked about, like, how in many cases we get split into two groups nationwide in a lot of different cases, but there is in this research some data that shows that your belief system is kind of tied into even the way you feel about the pandemic, and it goes both ways. And it talked about, one side not believing in masking and social distancing and the spread of the disease. The other side, though, kind of almost believes too much, and that there are some challenges in there on, how fast we bring kids back to school, and things like that, how different age groups are affected. It was just kind of interesting, to look at that. But Dr. Person, let's move into vaccines. Can you kind of give us an overview of the different vaccines that are out there, and then what's available? And like, I know there's a mass vaccination site that's in Benton County, and you talked about the vaccination rates are a little higher than in Benton than Franklin, but did some of those rates come from the mass vaccination site and easy access? Or I assume that's probably, you're tracking it by zip code, so somebody from Franklin could come and, if they qualify, and get a vaccination in Benton. But I want to maybe just start off with the different vaccines that are out there, and what's available here locally.
Sure, absolutely. So there are currently 3 vaccines that have received emergency use authorization from the FDA. We have, the first one was the Pfizer vaccine, which is a 2-dose vaccine given 21 days apart minimum. That's the vaccine that has had the initial ultra cold storage requirements. So it was a challenge for some places to be able to adequately store it. That was followed shortly by Moderna, which is another 2-dose vaccine that needs to be maintained frozen. The most recent vaccine that's become available is the Johnson & Johnson, and some key differences with that one is that it is a single-dose vaccine, and it only needs to be kept at refrigeration. So similar to many of our other existing vaccines, storage and use in a wider range of areas with wider ranges of resources is possible. All of the vaccines have been shown to be very effective in preventing hospitalization and death, which is, really our end game. As much as we talk about transmission, we talk about transmission because the more people who get sick, the more chance we'll have people who end up in the hospital or who end up dying. And that's really what we want to stop. Trying to compare all of the vaccines in terms of how their efficacy against preventing you from getting COVID-19 at all or from transmitting it is a little challenging right now because of the way that each of them were studied. And this is something we're watching as it goes on. The more people have been vaccinated, the more we are seeing that vaccination does reduce the likelihood of transmission, which again is another plus. All of the vaccines are available locally, although it changes at any given day if you can find a place that has a specific vaccine. Our advice to people is that the best vaccine for you to get is the one that actually gets into your arm, no matter which one it is. Our mass vaccination site in Benton County is using the Pfizer vaccine. And one of the reasons for that is with its very high throughput. I mean, they are vaccinating 1,000+ people every single day. They're able to use that supply in a timely fashion. The federal pharmacy programs and the programs for federally qualified health centers are providing primarily Moderna vaccine and Johnson & Johnson vaccine. So that's helping us reach areas or populations that may not be able to travel to our mass vaccination site. But that site is a regional one, so we're welcoming anybody. They don't have to be a Benton County resident. The requirement is just because this site is technically run by the State Department of Health, is that you have to work or live in Washington State.
Oh, that's great. I love your advice too. Like, the best vaccine that you can get is the one that goes into your arm, right? And I think again, when we talked about it today a lot, but since this is new, I think just as an individual, wouldn't you prefer not to get sick, right? I mean, the whole conversation, and if there's something that you can be vaccinated with that helps you not get sick, I think, at least I'm personally and my family, we're big believers in that. So we're we're looking forward to be able to get those vaccinations. That's great. And is there, so with the regional mass vaccination center, I know originally we were kind of split into this South Central region. Was that kind of the scope for the mass vaccination now? But now is it opened up? Like anybody, like you say, that has, say, a Washington license plate on their car can come, or you know, how far are we seeing people come into the fairgrounds in Benton County?
We've seen people come from, actually, I think even originally we saw people coming from outside of Washington. I mean, they were former Washington residents, but we have seen people coming from across the pass or from even the east side of the state. Again, because thanks to our Southeast Washington Incident Management Team, that is the one that is running the site under delegation from the Department of Health, and the local group of National Guard that are manning it, we were able to get that one stood up very quickly, and after some initial hiccups, to have it running very efficiently. We give the most vaccines out of all the 4 mass vaccination sites across the state. So we did see people coming here because that's where vaccine was, and that's our goal. We don't want to say we're only vaccinating in our area, because we do understand that viruses, that they don't respect city boundaries, county boundaries, state boundaries, country boundaries. So the more we can have everybody protected, the better off we are. You know, and our goal with vaccination is really for people to also have the choices that they want. So if somebody really wants a certain vaccine, again, all types are available in our community. You just may have to dig a little harder to find some of them, but you know, again, we're not here to shove vaccine down people's throat. We just want them to be able to make an informed decision, which means to know all of the facts about the benefits of vaccine, the risks of vaccine, the benefits of not getting infected with COVID-19.
And that's the goal for everyone. And however it comes about, and obviously that relates back to all the things that we've talked about before: masking, social distancing, washing your hands. Jason, from a health district point of view, and I don't know that collectively or, you know, statewide as health districts go, that are you guys able to look forward and say, you know, what does the new normal look like? Or from the health district point of view, as we reach, you know, a greater concentration of vaccinations and people getting sick, as the doctors described, like what do we have a sense of what the future might look like? And I think there's a lot of discussion that people say, like, well, how long will we wear masks? You know, and I remember the last airplane trip that I took a year ago and seeing more people in the airport wearing masks, you know, and just thinking, like, I wonder if we're all going to be wearing masks. And now looking back, obviously that's changed a lot, but what do you see coming up in the future? And obviously wearing a mask would be a great example of people are free to wear masks wherever they want to. But from a health district point of view, have you guys been able to kind of start looking forward and saying, what, you know, what's that future going to look like?
Yeah, that's a really great question, Carl. And of course, no one has a crystal ball to predict with precision what that future will look like. But at least in the near term, I think, and I'll try and put on my thinking cap as best I can and predict the long term thereafter. But short term, I think, you know, really it goes back to what Doctor was talking about in terms of getting the vaccine. You know, one message I would just try and give for people listening: go get your vaccine. Any vaccine you can find, get it. And with that, I would think that masking is going to continue for a while longer, for sure. One thing I think that public health is really concerned about is vaccine hesitancy. In the near term, we want to make sure that people know that the vaccines are safe. The vaccines have been tested. They've been proven. They save lives. Don't hesitate. So I won't beat that one up any further, but just in case we get cut off towards the end, I wanted to make sure I got that in there. I would expect social distancing to continue to play a big factor. And then, of course, getting our kids back in school is going to be a big push for us here now, coming up in the near-term future. Looking a little further down the road, I think that once the vaccines are widely available, which will come roughly May 1st, at least the appointments should be there for folks, then it's going to just become a matter of education for folks that have not gotten the vaccine. If they're on the fence a little bit, here's additional information for you to consider. And then we'll move into our new normal. You know, one of the things that I think that we've been very fortunate, and we haven't really touched base on this, but, and this is really a topic better addressed by Dr. Person, but one of the things that we've seen is that our influenza rate has been reduced as a result of washing your hands, maintaining your social distance, wearing face coverings. So that has been a really, really big plus for us in terms of not having to fight that quite as hard as we have had to in the past. In the new normal, I think looking a little further down the road, people will be able to get back to hopefully a reasonable sense of what was before. In other words, the pre-COVID piece. We will emerge out of this. It's just a matter of time. And that's where the crystal ball becomes a little fuzzy. But our best predictor is as our relatively new president has mentioned, you know, we need to open up vaccines for everyone come May. And so we're very much looking forward to that. I think our industry supply has been ramping up significantly. So we're going to see that happen. And that's going to be a big benefit for a lot of people. And what we'll see is folks will be able to go into their backyards, invite friends over, maybe not a huge crowd, but you know, you'll be able to do that and no one's going to be looking over your shoulder. We're going to be able to spend more time with family. I think that's going to be extremely important, spending time with extended family. And hopefully people will, at least until we get to that point where we feel we're fully at the end, will continue to do those things that we know from a scientific perspective are helping mitigate this virus spread.
That's, like I say, nobody has a crystal ball, but I appreciate you just at least taking a forward look. I think that's what's on a lot of people's minds, and especially small business owners thinking about how do we get back to that. And of course, everybody's looking forward to going to phase 3 next Monday and being able to increase some of those inside seating ratios. Dr. Person, and I think this has been a role of public health, but that educational component, Jason, you just talked about education, you know, being part of it, and I realize that there's groups in the community that aren't going to be excited about this, but, you know, is there anything else that we could do or increase activities, you know, in our public education system to increase knowledge of public health and safety, things that relate to a pandemic? Any thoughts around that? And it can just be your opinion. I'm not looking for like an official position or something, because I know it's a pretty open-ended question, but just thinking about it, like, how do we change that dynamic? And I'll just say, like, you know, I'm 53 years old and I can remember being a kid. I just don't remember so much debate going on at a local level on what is science. It seems like we've, you know, for a lot of different reasons, we don't have to get into that, but it seems like, you know, how science works, do we trust it or not, it is kind of different now than it was, you know, 40, 50 years ago. Any thoughts about, you know, a public education component to just talk more deeply about how science works, how public health works, and how some of these safety standards, you know, that we could all kind of learn together?
You know, that's great. And it is something that we need to think about. Part of that, in my mind, is really looking at how we approach behavior change, because that's what a lot of this really boils down to. And we're really moving into a world where the choices that we make as individuals, as communities, as nations, and as societies really drive what happens with health. So it's part of it's two-pronged. Is one, it's getting everyone to recognize that health isn't just about the genes you were born with, or even who your doctor is. It's affected by, again, your zip code. So how do we make sure that health is part of those discussions that businesses are having, that governments are having? And then I think on the flip side, it's also how do we approach from a public health standpoint, talking about people about how they might change their behavior. And one of the things we've learned is that we can't just throw a bunch of facts at people. We can't, we've always relied on, well, we've got the science behind us, we have the data behind us. Well, particularly these days with through social media and internet, I mean, data available in all shapes and sizes everywhere. So it's not just the data, but how do we translate data into information that is meaningful for people, and how do we recognize people being where they are in thinking about their health, and recognizing that even groups that don't ever agree with us, it's not because they don't believe in being healthy, just they have a different frame of mind. And so we really need to think about how we tell that story. And so we need to become better. I feel like we need to become better storytellers, because public health isn't just about the numbers. I mean, when we're all here doing our work, we're not thinking about numbers. We're all thinking about the people that we in our families, the people and the coalitions that we work with. I mean, it's all very, a lot of it is very personal, but it's not something that we often are comfortable sharing, because again, always been taught, well, it's about the science, don't get personal with things, just talk about the science. But the numbers aren't what move people. You have to have the numbers because we are driven by data, but we have to understand that it is those stories, it's what's personal, that's really what is going to resonate with people. So when we again look at our future staffing or future, what are those skills we want to build, it's building those skills in the staff, and recognizing that the staff we have that have been doing care coordination work in HIV, or leading some of our coalitions to reduce substance use in teens or improve their mental health. Those are skills they can be using everywhere. And so when we think about how we fund public health, being able to say that because somebody is good at leading a coalition to reduce adolescent drug use, we shouldn't only have to use them there, that skill is the same great skill to lead a coalition to talk about how we can, ensure that our schools are going to be safe for staff and students from a COVID-19 perspective. So how do we build skills, not so much just how do we build projects?
Thank you. I think that was really well said. And I think, from a marketing perspective, the first question you have to ask or answer in marketing is why, or why should I care? And I think to answer that question more with those personal stories versus data, it's a great point, because it's really about people, right? To your point, we're just people, we're neighbors, and we're friends and community members and coworkers. And ultimately we all do care about each other. And so stories are a great way to help us relate to each other and understand that a lot better than, this number or that number. And a great point. And maybe Jason, a wrap up question, and then we'll get into some closing remarks. But mean, might that be something that you know, comes out of public health, that communications role? And obviously we know, you know, you guys have all worked really, really hard to increase the frequency and so many different measurements of communications through this pandemic, through, you know, from convening the groups to public outreach and even advertising and all those things. But you think communications and / education will be a bigger part of public health in the future moving forward, maybe?
I would think so, Carl. I really do. Like Dr. said, and you said, I think communication, well, it almost always boils down to communication, doesn't it? I mean, whether we're at the workplace, whether we're at home with our families, there's family dynamics, there's organizational dynamics, and really what public health tries to do is to utilize science and utilize data for decision making. And then, as Doctor said, what's coming on stronger and stronger is the notion of telling the story to be able to relate to people, and for people to be able to relate to public health, what we're saying, and with the end goal of behavior modification for the better. So if we can change people's behaviors so that they're either safer or they're healthier, so much the better. That will help people to live full and productive lives. And that's part of what our mission statement says. And so I think that's going to be a significant role going forward. And the better that public health can get at refining and honing messaging, whether it's through storytelling, whether it's through education, or whether it's pulling on heartstrings, if that's what it means, whatever it takes to reasonably get the idea across to people. You know, folks out there aren't subject matter experts in public health. We don't expect them to be. And our hope is that they will just listen, review the data, listen to what we're saying. People get information from so many different channels these days, and it's hard for us in public health. And I know we're starting to run out of time, so I'll be quick. It's hard for us in public health to watch some of the negativity that comes across. You know, when we're genuine in what we're doing, and just I think to wrap it up, the better we can get at refining and honing our messaging through storytelling, through data, through discussion, through just interactions, we will all be better off as a community that way.
Thanks, Jason. That was really well said. Well, we are at the end of our hour, and I just want to thank you both for your time today. You've come on so many times and always given us really good information that we can share with you know, so many different audiences, and then we keep these videos online for a while. But you know, thank you both for your work and your dedication. I know you guys haven't had much, if any, time off in a year, and you know, appreciate your time today. And Dr. Person, you want to give us a closing remark as we wrap up here?
Sure. You know, I'll just say what I think is important for all of us to remember is that it's not about how we're different from one another, but, you know, trying to find what those commonalities that we all share. And it's also important that when we're talking about behavior change, it's not just about what we're asking individuals to do, but also looking at what are the barriers that are in place, whether in our businesses, in our communities, in our society, in our histories, that are getting in people's way, recognizing those, and let's break those down as well, so that people can make the choices that we'd like them to make.
Very well said. Thank you, Jason. You want to have a closing remark, and maybe just to give you a little primer? You talked about it before, but you want to say anything about vaccinations?
No. Well, I will just state that let's all remember we are all in this together. Thanks for everyone and all of their hard work, whether it comes to our elected officials, our school partners, the families out there in our community, and our small businesses, as well as our first responders. This has not been an easy task. We will get through it. Go get your vaccine if it's available to you and you're in the right phase. Go get it. And lastly, please let's take that effort now over the next 2 to 3 months while the vaccines continue to roll out to double down our efforts on, let's all say it together, washing our hands, masking up.
Wearing a mask.
We beat this thing to death, but it's so important. It's just another couple months. People just need to hang on, and we'll be out in much better shape. So, and thank you, Karl, for providing this venue for us. This has been very helpful.
You bet. Well, thank you both again for coming on and joining us again. We always appreciate having you on and the information that you can share with us. And I think, for everybody that's joining us today, I think great words to leave on. It's been hard for everybody. There's been folks that have been on the front lines of this that haven't had a break. Many people affected, small businesses, people out of work. We know that there's many people in our community suffering, but if we can just hang together, like you said, for a couple more months, things are getting better. And as a community, again, we've pulled together and we're making it through. The numbers are getting better, and better things to come in the future. So thanks again, both of you, for your time. And thanks for everybody joining us today. Have a good weekend.
Thanks.
Thank you.
Bye.
Bye.